Imagine a world where your own body, the very system designed to protect you, suddenly turns into your fiercest adversary. This isn't a plot from a sci-fi movie, it's the daily reality for millions living with rheumatoid arthritis, or RA. This chronic autoimmune disease is far more than just joint pain, it's a relentless battle where the immune system, misguided and aggressive, wages war on healthy tissues, primarily targeting the lining of your joints. The implications extend far beyond physical discomfort, impacting every facet of life and fundamentally altering one's perception of their own body. Understanding RA means delving into the intricate complexities of our immune system and confronting the profound challenges it presents. At its core, rheumatoid arthritis is a systemic inflammatory disorder. Unlike osteoarthritis, which is often a wear-and-tear condition, RA is characterized by the immune system mistakenly identifying the synovium, the protective membrane lining your joints, as a foreign threat. This triggers an inflammatory response that, over time, can lead to severe pain, swelling, and eventually, joint erosion and deformity. The chronic nature of this inflammation means constant vigilance and a lifelong journey of management, as the disease progresses through cycles of flares and remission, each one leaving its mark on the body and the spirit of the individual. While RA's signature battleground is the joints, its reach is far more extensive. As a systemic disease, it can impact various other organs, including the skin, eyes, lungs, heart, and blood vessels. This widespread involvement underscores the severity and complexity of RA, transforming it from a localized ailment into a condition that can affect virtually every system in the body. The systemic nature means that even when joint symptoms are managed, other parts of the body may still be silently struggling, necessitating a holistic approach to diagnosis and treatment to address all potential complications. The exact cause of rheumatoid arthritis remains one of medicine's most elusive mysteries. Scientists believe it's a complex interplay of genetic predisposition and environmental triggers. While you can't catch RA, having certain genes, such as specific HLA types, significantly increases your risk. However, genetics alone aren't enough. An environmental factor, perhaps a viral or bacterial infection, or even exposure to certain chemicals, is thought to kickstart the autoimmune cascade in susceptible individuals. This intricate dance between nature and nurture makes pinpointing a single cause incredibly challenging and highlights the unique journey of each patient. Let's delve deeper into the genetic component. Research has identified several genes that increase the risk of RA, with HLA-DRB1 being the most prominent. These genes play a crucial role in immune system regulation, particularly in how the body distinguishes between self and non-self cells. When these genes are present, a person's immune system might be more prone to misidentifying their own tissues as foreign invaders, setting the stage for an autoimmune attack. It's not a guarantee, but a significant predisposing factor, creating a vulnerability that environmental triggers can exploit. Environmental triggers are the puzzle pieces that complete the picture. Smoking, for instance, is a well-established risk factor, significantly increasing both the likelihood of developing RA and the severity of the disease. Certain infections, especially those involving bacteria in the gut or gums, are also under investigation as potential triggers. The theory is that these environmental insults might alter proteins in the body, making them appear foreign to a genetically predisposed immune system, thereby initiating the autoimmune response. Understanding these triggers is vital for prevention and management strategies. Early symptoms of rheumatoid arthritis can be subtle and easily mistaken for other conditions, making early diagnosis a significant challenge. Typically, RA begins with symmetrical joint pain and stiffness, often affecting the smaller joints of the hands and feet. This stiffness is usually most severe in the morning, lasting for more than 30 minutes, sometimes even several hours. Fatigue, low-grade fever, and a general feeling of being unwell, malaise, can also precede or accompany joint symptoms, signaling the systemic nature of the inflammation already at play. As RA progresses, the inflammation intensifies, leading to more pronounced swelling, tenderness, and warmth in the affected joints. The pain can become constant and debilitating, severely impacting daily activities. Over time, chronic inflammation can erode cartilage and bone, causing irreversible joint damage and deformity. This destructive process is often gradual but relentless, making early intervention crucial to preserve joint function and improve long-term outcomes. The visible changes in the joints are a stark reminder of the internal battle being fought. One of the hallmark features of RA is its symmetrical presentation. If a joint in one hand is affected, it's highly probable that the corresponding joint in the other hand will also experience symptoms. This symmetry is a key differentiator from other types of arthritis and helps clinicians in their diagnostic process. While not always absolute, this pattern is frequently observed and provides a crucial clue in unraveling the mystery of a patient's symptoms, guiding doctors towards an accurate RA diagnosis. The impact of RA extends far beyond physical discomfort. The chronic pain, fatigue, and limitations in mobility can significantly affect a person's mental health. Depression, anxiety, and feelings of isolation are common among RA patients, as they grapple with the unpredictable nature of their disease and its profound effect on their independence and quality of life. The emotional toll is as real and challenging as the physical symptoms, necessitating comprehensive care that addresses both mind and body. Diagnosing rheumatoid arthritis is often a multifaceted process, combining a thorough physical examination, detailed medical history, laboratory tests, and imaging studies. There's no single definitive test for RA, making the diagnostic journey sometimes lengthy and frustrating for patients. Rheumatologists, specialists in diseases of the joints, muscles, and bones, play a critical role in piecing together these various clues to arrive at an accurate diagnosis, often requiring multiple visits and careful observation over time. Blood tests are crucial diagnostic tools. Key markers include the rheumatoid factor, RF, and anti-citrulline protein antibodies, ACPA or anti-CCP. While RF can be present in other conditions, ACPA is highly specific for RA and often appears very early in the disease course, sometimes even before symptoms manifest. Elevated inflammatory markers like C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, also indicate active inflammation in the body, further supporting a diagnosis of RA. These tests provide invaluable insights into the internal inflammatory processes. Imaging studies, such as X-rays, ultrasound, and MRI, help assess the extent of joint damage and inflammation. X-rays can reveal bone erosion and joint space narrowing, although these changes typically appear in later stages. Ultrasound can detect early inflammation in the synovium and subtle erosions that might not be visible on X-rays. MRI provides the most detailed view of soft tissues, cartilage, and bone, making it particularly useful for early detection of inflammation and damage, guiding timely intervention and treatment adjustments. Early diagnosis is paramount in managing RA effectively. The window of opportunity for preventing irreversible joint damage is critical, often referred to as the window of opportunity. If diagnosed and treated within the first few months of symptom onset, patients have a much higher chance of achieving remission or low disease activity, significantly improving their long-term prognosis and quality of life. This emphasizes the importance of recognizing early symptoms and seeking prompt medical attention, as every month counts in the fight against RA. The primary goals of RA treatment are to reduce inflammation, alleviate pain, prevent joint damage, and preserve function. Treatment strategies are highly individualized, tailored to the patient's disease severity, progression, and overall health. This personalized approach is essential because RA manifests differently in each individual, requiring a dynamic and adaptable treatment plan. The aim is to achieve sustained remission, allowing patients to live full and active lives despite their chronic condition. Disease-modifying anti-rheumatic drugs, MARDs, are the cornerstone of RA treatment. Methotrexate is often the first-line MARD, working by suppressing the immune system and reducing inflammation. Other traditional MARDs include sulfasalazine, hydroxychloroquine, and leflunomide. These medications can take several weeks or months to show their full effect, requiring patience and consistent adherence from patients. Their long-term use is critical for controlling disease progression and preventing irreversible damage. Biologic MARDs represent a revolutionary advancement in RA treatment. These genetically engineered proteins target specific components of the immune system involved in the inflammatory process. Examples include TNF inhibitors, e.g., adalimumab, etanercept, IL-6 inhibitors, e.g., tocilizumab, and B-cell inhibitors, e.g., rituximab. Biologics are often used when traditional MARDs are insufficient or poorly tolerated, offering potent disease control and significantly improving outcomes for many patients. They've truly transformed the landscape of RA management. Targeted synthetic MARDs, known as JAK inhibitors, e.g., tofacitinib, baricitinib, are another class of newer medications. Unlike biologics, which are typically injected, JAK inhibitors are oral medications that work by blocking specific signaling pathways inside immune cells, thereby reducing inflammation. They offer another powerful option for patients who haven't responded well to other treatments, providing the convenience of oral administration with targeted immune modulation. These innovations continue to expand the arsenal against RA. Corticosteroids, such as prednisone, are potent anti-inflammatory drugs often used to quickly reduce pain and swelling during RA flares or while waiting for DMARDs to take effect. However, due to potential side effects like bone loss, weight gain, and increased infection risk, they are typically used at the lowest effective dose for the shortest possible duration. They serve as a crucial bridge therapy, providing rapid relief but not as a long-term solution, highlighting the delicate balance required in treatment. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen can help manage pain and reduce inflammation, but they do not alter the disease course. They provide symptomatic relief and are often used in conjunction with DMARDs. While effective for pain management, long-term use of NSAIDs can carry risks, including gastrointestinal issues and cardiovascular problems, underscoring the importance of careful monitoring by a healthcare provider. They are part of the pain management strategy, but not the core disease treatment. Physical and occupational therapy are integral components of RA management. Physical therapists help patients maintain joint flexibility, strength, and range of motion through tailored exercises. Occupational therapists assist with adapting daily activities and recommending assistive devices to minimize joint strain and improve independence. These therapies empower patients to manage their symptoms, prevent further damage, and maintain a higher quality of life, complementing medication by addressing the physical limitations imposed by RA. For severely damaged joints that significantly impair function and cause intractable pain, surgical interventions may be considered. Procedures like synovectomy, removal of inflamed synovium, tendon repair, joint fusion, or total joint replacement can dramatically improve function and reduce pain. While surgery is typically a last resort, it can be life-changing for patients with advanced disease, offering renewed mobility and relief from chronic agony, allowing them to reclaim aspects of their lives. Lifestyle modifications play a crucial role in managing RA. A balanced, anti-inflammatory diet, rich in fruits, vegetables, and omega-3 fatty acids, can help reduce systemic inflammation. Regular, low-impact exercise, such as swimming or cycling, maintains joint flexibility and muscle strength without excessive stress. Quitting smoking is paramount, as it significantly worsens RA progression and reduces treatment efficacy. These simple changes, though challenging, can profoundly impact overall well-being and disease activity. Stress management is another vital aspect of living with RA. Chronic stress can exacerbate inflammation and worsen pain. Techniques like mindfulness, meditation, yoga, and deep breathing exercises can help manage stress levels, thereby potentially reducing disease activity and improving coping mechanisms. Prioritizing rest and adequate sleep is also essential, as fatigue is a pervasive symptom of RA that stress can intensify. Holistic approaches to mental and emotional well-being are as important as physical interventions. Support groups offer invaluable emotional and practical support for individuals living with RA. Connecting with others who understand the unique challenges of the disease can reduce feelings of isolation, provide a safe space to share experiences, and offer practical advice on coping strategies. Knowing you're not alone in your journey can be incredibly empowering and helps foster resilience in the face of chronic illness. These communities become a lifeline for many, offering comfort and understanding. The journey with rheumatoid arthritis is often unpredictable, characterized by periods of flares and remission. Flares are acute exacerbations of symptoms, with increased pain, swelling, and fatigue, while remission is a period of minimal or no disease activity. Understanding and recognizing the triggers for flares, such as stress, infection, or overexertion, can help patients better manage their condition. This cyclical nature necessitates ongoing communication with healthcare providers to adjust treatment as needed. Complications of RA can extend beyond joint damage. Cardiovascular disease risk is elevated in RA patients due to chronic inflammation. Other potential complications include osteoporosis, carpal tunnel syndrome, rheumatoid nodules, firm lumps under the skin, and Sjogren's syndrome, dry eyes and mouth. Regular screening and proactive management of these comorbidities are essential to ensure comprehensive care and prevent serious health issues, highlighting the systemic impact of RA. The role of inflammation in RA is central to understanding its systemic effects. Chronic inflammation can cause damage to blood vessel linings, increasing the risk of atherosclerosis, heart attacks, and strokes. It can also interfere with bone metabolism, contributing to osteoporosis. This interconnectedness emphasizes that RA is not just a joint disease but a condition that requires a holistic view, with every organ system potentially affected by the persistent inflammatory state within the body. Rheumatoid factor, RF, and anti-CCP antibodies, while useful for diagnosis, can also be prognostic indicators. High levels of these antibodies are often associated with more aggressive disease and a greater likelihood of joint damage. Patients with these markers may require more intensive treatment strategies from the outset to control inflammation and prevent irreversible changes. This helps rheumatologists tailor initial treatment plans more effectively, aiming for early and aggressive intervention. The development of new diagnostic criteria has significantly improved the ability to identify RA earlier. The 2010 American College of Rheumatology/European League Against Rheumatism (ACR/EULAR) classification criteria emphasize early inflammatory arthritis symptoms, serological markers, and duration of symptoms. These criteria allow for diagnosis even before significant joint damage occurs, paving the way for timely intervention and better long-term outcomes for patients. It's a critical step forward in RA management. Research continues to unravel the complex genetics of RA. Genome-wide association studies, GWAS, have identified numerous additional genetic loci associated with RA risk, beyond the well-known HLA genes. These discoveries are shedding light on new biological pathways involved in RA pathogenesis, offering potential targets for novel therapies. Understanding these genetic underpinnings is crucial for developing personalized medicine approaches and potentially even preventative strategies in the future. The gut microbiome is emerging as a fascinating area of research in RA. Studies suggest that an imbalance in gut bacteria, dysbiosis, may play a role in triggering or exacerbating autoimmune responses. The gut-joint axis hypothesis proposes that gut microbes can influence systemic inflammation, impacting disease activity in RA. This opens up exciting possibilities for therapeutic interventions, such as dietary modifications or probiotics, to modulate the gut microbiome and potentially improve RA outcomes. Beyond conventional medicine, many RA patients explore complementary and alternative therapies. These can include acupuncture, massage therapy, herbal remedies, and dietary supplements. While some may offer symptomatic relief, it's crucial to discuss any complementary therapies with a healthcare provider to ensure they don't interact negatively with prescribed medications or delay effective conventional treatment. A holistic approach can be beneficial, but it must be informed and safe. The future of RA treatment holds immense promise. Personalized medicine, guided by genetic profiling and biomarkers, aims to tailor treatments to individual patients for maximum efficacy and minimal side effects. Further advancements in biologic and targeted synthetic MARDs are continuously being developed. Research into preventing RA in high-risk individuals and even achieving a cure remains an active and hopeful area of scientific inquiry. The landscape of RA care is constantly evolving. Living with rheumatoid arthritis is a daily challenge, but it's also a journey of resilience and adaptation. With early diagnosis, effective treatment, and comprehensive self-management strategies, many individuals with RA can achieve good disease control, maintain joint function, and lead fulfilling lives. The key is proactive engagement with healthcare teams, adherence to treatment plans, and a commitment to lifestyle choices that support overall well-being. It's about empowering oneself to manage the disease, rather than letting the disease manage you. Raising awareness about rheumatoid arthritis is crucial. Many people still misunderstand RA, often confusing it with osteoarthritis or dismissing it as just joint pain. By educating the public about its autoimmune nature, systemic impact, and the importance of early diagnosis and treatment, we can foster greater empathy, reduce stigma, and encourage timely medical intervention. This collective understanding can make a significant difference in the lives of those battling this challenging condition. In conclusion, rheumatoid arthritis is a complex and often debilitating autoimmune disease that demands a multifaceted approach to diagnosis and treatment. From its enigmatic causes and insidious onset to the profound impact on joints and other organs, understanding RA is the first step towards effective management. While the journey can be arduous, the advancements in medicine and the power of self-advocacy offer hope for improved quality of life. We hope this deep dive has empowered you with knowledge and a deeper appreciation for the silent battles many face daily. Thank you for joining us on this important exploration.